Call this meeting to order. Welcome to meeting number 146 of the House of Commons Standing Committee on Health. In accordance with our routine motion, I'm informing the committee that all remote participants, with the exception of Dr. Hanley, have completed the required connection tests in advance of the meeting. We will have Dr. Hanley's issues resolved before we call on him to speak. Subject, okay, we're going to skip over the budget. Pursuant to Standing Order 108 Sub 2, the committee is commencing its study of the subject matter of the Supplementary Estimates B 2024-2025. I'd like to welcome our panel of witnesses joining us today. We have the Honourable Mark Holland, Minister of Health, and he has with him a team of officials accompanying him. From the Canadian Food Inspection Agency, Diane Allen, Associate Vice President, Policy and Programs. From the Canadian Institute of Health Research, Dr. Tammy Clifford, Acting President. From the Department of Health, Eric Costin, Associate Deputy Minister. From the Public Health Agency of Canada, Heather Jeffrey, President. Dr. Kerry Robinson, Acting Vice President, Infectious Disease and Vaccination Programs Branch. And Lindsay Hollett, Assistant Deputy Minister, Regulatory Operations and Enforcement Branch. Thank you all for being here, albeit somewhat delayed. You're very familiar with with how things work here, and so I'm just going to hand it over to you, Minister. Welcome to the committee. You have up to 5 minutes for your opening statement.
Well, thank you very much, Mr. Chair. And yes, I was hoping we had made a request to come here before the supplementary estimates, but nonetheless, a very important conversation to have. And I thank you, Mr. Chair, to be able to be here today. You referenced a number of officials. I want to take a moment to really thank them for their extraordinary work on behalf of the country. It is my very deep and great privilege to get an opportunity to get to work with them and as they work to serve Canadians. I'm going to talk at kind of a high level, if I could. I think we're in a moment of incredible consequence for healthcare in Canada. And it is wonderful. I've been having an opportunity over the last couple of months, as I do really all the time, to go and talk with stakeholders, but particularly the optimism within the health sector about the transformation that's possible. I just came back from Alberta on Friday, and I want to say a conversation with Adriana LaGrange around the possibility of working together and finding solutions, being able to talk about common language. There's a lot of differences we have, but one of the things that when you look at the transformation that must occur in our health system, there's a lot of areas of commonality that I think are really worth focusing on. 70% of chronic disease and illness can be prevented. Most of what fills our hospital rooms and hospital beds don't need to be there. And having effective response on prevention not only makes sense as a matter of health outcomes, it fundamentally makes sense economically. It's something that can unite us whether or not we are on the thinking about social justice and health outcomes, or we're thinking about productivity. And I have to say, around the federal provincial table, the positivity, the effort to set aside partisanship and find common ground has been deeply heartening. I had a conversation with Jeremy Cockrell, who's the new health minister in Saskatchewan, around that was very positive. Michelle Thompson, very positive. So I look forward to talking to the committee in that spirit and to take your questions in that spirit, because we've been able to do some really important things. Let me start with dental. The most recent update, 93% of providers are participating. Now, you might recall that some folks said that we weren't going to have anybody sign up. 93% is pretty fantastic. Manitoba is leading the pack now with nearly 100%. In fact, we're having to redefine 100% because people who come forward we didn't even know were providers. In terms of the number of people who've received care, 1.25 million, and that's just over 7 months. In a year, 3 million registered. So I'm very excited for these next cohorts. And I mentioned dental to start because it's such an important area of both primary care and of health prevention, and also an example of where Parliament worked together in a spirit of collaboration. I see Peter Julian there and want to recognize Don Davies and the work that was done. It's difficult to find common ground and to ask constructive questions and how we can help Canadians, but I think that's what they expect us to do in a minority parliament. So now we're moving forward on the pharmacare agreements, which is also the product of cooperation in this chamber. That agreement is going to see diabetes medication and devices as well as contraceptives. It was wonderful to stand at a podium on drugs for rare diseases with Adriana LaGrange, making a commitment that Alberta is ready to move towards signing it. So I very much believe that all these agreements can be signed over the coming time. But one of the areas I'm really hoping today we can focus on, Mr. Chair, is Bill C-72. I'm not aware of anybody who's against the Connected Care legislation. This is legislation that will absolutely save lives. If you talk to Terry Price about her experience of her brother Greg and the problem with fax machines and data not being transferred, of a system that is not doesn't have interoperability, it places lives at risk. It blocks pathways to care, and it's one of the greatest frustrations for physicians. So I would ask, I understand there's a lot of things going on, there's a lot of concerns, but here's an example of, I think, where we can come together. There's lots of things we can disagree on, but this is one where I'm aware of no province, no territory who's opposed. I'm aware of no political party that's opposed. So I would ask parliamentarians' assistance to pass this. It will save lives. It will improve our health system, and I'm aware of nobody who's opposed to it. So hopefully we can spend some time on that. I would also just say in closing, Mr. Chair, I appreciate these conversations. I hope that I'm afforded, 20 seconds of context. I love playing Jeopardy, but this is an important conversation that we need to have around the future of healthcare in this country, and certainly is deserving of more than staccato 2-second questions. And I look forward to that opportunity to illuminate and have a conversation on the ways that we can work together to the betterment of our health system.
Thank you very much, Minister. I'm sorry to, but I'm going to be honest with you about your expectations. The rule that we've followed really since I took the chair on this committee is that the witness gets as much time to answer the question as the person posing it takes to pose it. There is an entitlement to cut you off if you go longer than the length of the question. They don't have to exercise that. They're free to let you continue, but it is up to them once you exceed the length of their question in your answer. I think what you will find is if there is one party, perhaps the official opposition, that tends to cut you off, you may find that there's another party that will give you a chance to expand upon your answer in a subsequent time slot. But the rule that I will be applying is the one that I just explained to you. You will have as much time to answer.
It's more a spirit than I appreciate your adherence to the rules and respect that, Mr. Chair, of course.
All right. So we're going to start now with rounds of questions in the manner to which we have become accustomed with Dr. Ellis for 6 minutes.
Thanks very much, Chair. And to you, Minister, you talked about illness prevention. Can you tell Canadians how many Canadians, in percentage-wise, are struggling to access fresh food, fresh and affordable food in Canada? You like the Jeopardy question, so here's number one.
Yeah, well, I suspect that you have an answer. I never quite understand why you ask me a question that you seem to have an answer to. I mean, food insecurity is very serious. I hope that we could take a second to talk about the answers to food insecurity. It is a devastating impact in First Nations communities, rural, remote communities. It is a very difficult thing to quantify because you have food insecurity that takes many forms, whether or not it's access to fresh fruits and vegetables or whether or not it's access to food at all. We have food deserts. So it's
Again,
difficult
Minister,
to enumerate.
thanks very much. It's clearly that you don't have the clue of what the answer is. It's 32%, which is almost a third of Canadians. And you know, again, maybe the second Jeopardy question that you seem to love, how many Canadians are visiting food banks on a regular basis?
Well, far too many. I mean, I think the question I would pose to you is...
No, you're not asking me questions.
Sure, I can. I mean, that's absolutely my prerogative. You don't have the opportunity in a democracy to tell me what I can and can't do, Mr. Ellis. You cannot like it. But I'm saying that I just spent 5 minutes talking about solutions. So do you want to talk about solutions to the issue that you just raised, or do you want to just play this game where you're now going to say some statistic? Because I'm not interested in that, to be honest.
As a matter of fact, Minister, I know that you don't know the answers because we've well established that. Or you're too embarrassed to say that 2 million Canadians access food banks on a regular basis because of your government's reckless spending. Given that statistics, when you look at it, What about your temporary tax trickery? You know, when you begin to look at this, why don't you enlighten Canadians as to the actual GST amount on things like fresh fruits and vegetables and unprepared meats? What would that be?
Well, first of all, access to food banks and policies surrounding it deal with poverty. This is the government that for the first time set targets on poverty and has met them every single year. Well, we've seen too many people increasing in poverty. We see much lower levels than we saw in 2015 when we had a government, and the Conservative government, that never prioritized poverty or people who are living in food insecurity. So I would ask you what policies you have, Mr. Ellis, that would address these issues. I can enumerate the policies that we have to deal with both food insecurity and with
Minister.
food banks that are global issues, but as far as I'm aware, you have no policies on these ideas.
Dr. Ellis, please.
It's interesting because I would suggest that my job, as being in the opposition, would be to hold you to account, not to give you policies. So please tell Canadians the GST amount, it's a simple answer, on fresh meats that need to be cooked and fruits and vegetables.
So I disagree. I was in opposition. I absolutely, when I was a public safety critic, advocated for changes in policies. You have advocated none. If you're going to raise poverty and say that you care about food banks or insecurity or any such matter, having absolutely no policy that addresses those issues is irresponsible. And simply just criticizing, anybody can do that. I have a 10-year-old can do that with Google.
Thank you very much, Minister. You know, it's very clear that you do not understand that on uncooked meats and fresh fruits and vegetables, there is no GST, which directly relates to your temporary tax trick on behalf of Canadians, sadly. Can you then go on and perhaps describe the actual foods which GST will be eliminated off of with your temporary tax trick?
Well, I'm here to talk about the supplementary estimates. And so you want to talk about, again, having no policies. I can ask you, why did you vote against the Canadian Dental Care Plan? 34,000 people in your home province have access care, a program that you said didn't exist. You said nobody would sign up for. More than 90% of people have now signed up. Why do you oppose dental care for people? Why do you, as a physician, not understand the importance of primary care that dental care represents?
You know, it's interesting, Minister, because when you look at your temporary tax trick, it actually goes directly to your program with respect to dental care, because, of course, on behalf of Canadians, you voted to remove the GST on candies, candy floss, chewing gum, chocolate, popcorn coated or treated with candy, chips, crisps, puffs, curls, sticks of popcorn, et cetera, et cetera. And could you tell me that the benefit on the dental health of Canadians that your tax trick would provide?
You might recall that this same measure was suggested by Aaron O'Toole as a temporary measure to give people relief and to give them a tax break, or something normally the Conservative support, but you don't in this instance. So I would ask again, what are your policies to deal with tooth decay? What are your policies to, actually it's to cancel dental care. You would take dental care away from people. It takes some nerve to talk about sugar on one hand and talk about axing dental care on the other. So you want to talk about oral health? What is your policy on dental care, sir?
It's very interesting, Minister, that you refuse to answer any of the questions, because that's why we invited you here, is to attempt to get some answers, which obviously you actually refuse to do. What about when we look at, Minister, the wait times in this country? Maybe this is easier for you. Can you talk about the recent report released by the Fraser Institute and talking about the longest wait times for care in the history of this country, which has happened, sadly, but not surprisingly, under your watch?
Well, actually, it's largely, you also know, of course, it's shared responsibility with the provinces, but the Kai-Hai report actually showed, which is an independent report, progress in all of those metrics. But let me come back to it. Talk about sugar. You're against giving people diabetes medication. So, you know, you're going to talk about what we're doing on sugar, and you're against diabetes medication? You're going to criticize us on sugar in somebody's mouth, but you're against dental care? Sir, are you a physician? And if you are a physician, what would you do about people's oral health other than cut their dental care?
Sugar, Minister, you're laughable. Your answers are actually quite hilarious on behalf of Canadians. I think it's absolutely shameful that you do not understand how things work. So you want to give them diabetes medications because you want to give them more sugar?
Point of
That's your
order.
time.
Shameful.
Point of order, Mr.
That's your time, Dr. Ellis. A point of order from Ms. Sidhu.
Let's be respectful to each other. That's what I just want to request. Thank you.
Respect is earned.
Yeah, it certainly is. All right, that's it for Dr. Ellis. Next, over to Dr. Hanley, please, for 6 minutes.
Thank you, Mr. Chair. And I just want to check that I'm being heard okay. Is my sound okay?
Yes, hold on a minute.
Okay.
No, the sound is
Just-
not good.
Okay.
Can you move
Okay.
your microphone a little bit?
Okay, can I check? How
Yeah,
is this?
you
Is
can
this
keep
any
talking.
better? Okay, I'll just keep talking, and if you can stop me if I'm not being heard. I just
Yes.
appreciate your presence, Minister Holland. And right off the top, I just want to say that I have agreed to share my time with Mr. Morris, who is standing by
Dr.
on
Hanley, we
screen
Dr.
as
we
Hanley,
don't
we
have the
cannot hear
go-ahead
you.
on your sound yet, so what you're undergoing right
Okay.
now, even though you don't realize it, is a sound check.
Oh, I see. Okay, then should I be
Yeah,
talking
you can
about the
you can
weather?
talk about the weather, please.
Okay. Well, the weather is mild, and there's a little bit of rain, perhaps in the clouds, and I'm hoping that this is going to work for sound sound quality purposes. Do I have to go ahead?
I think there's an echo. Hold on.
Okay. Am I to keep talking? I'm not quite sure what to do. I'm sorry. I apologize
Yes,
for.
yes, please keep talking.
Okay, I will keep talking. I just want to ensure that I have a chance to ask my questions today of the minister, and so hoping that you're hearing me adequately. And I have my headset connect.
Our
So,
IT guy is going to call you because the connection is poor too.
Okay, okay, I'll defer for now. I wonder if Mr. Morris.
Hanley, we're going to
can,
go to the next
use
Liberal.
this
We'll come
time.
back to you with the next Liberal slot. Hopefully the problems will be resolved.
Okay.
We're trying to respect everyone's time here. So Ms. Sidhu, please, for 6 minutes.
Thank you, Mr. Chair. Thank you, Minister, and all the officials to be with us today. My question is to Minister. You talked about in the testimony and the opening remarks about Pharmacare Act provided universal coverage for a range of contraception and diabetes medication and plus devices. Could you tell us some more about the importance of this measure and why it's not included in this?
Well, thank you so much. So the previous budget 2024, had provided dollars for us to launch the first deals. Obviously, we're well into the year, so when these deals are signed, they'll be prorated. But, I mean, you look at the fact, and I want to thank you for your advocacy in the area of diabetes. It's been so important. This country spends about $30 billion a year managing diabetes. It is and that's just in direct health costs. It doesn't attribute to lost productivity and the cost of business in this country. And so the biggest challenge within that is folks not being able to access their medicine. And I can tell you it's devastating to talk to doctors who have patients in front of them who can't follow through on their treatment regime because they don't have money for their medicine. And so it is fundamentally essential that everybody be connected to the medicine that they need. And this is a really important step forward. And I think a great example of what Parliament can accomplish when we focus on shared objectives. So we're ready to sign those deals very soon. There's obviously a lot that goes into them. As you would have seen from the Memorandum of Understanding in British Columbia, there's an opportunity to go further than what Parliament envisioned. In British Columbia, we had hormone replacement therapy for women, the drugs involved in that, added to the list, which is deeply exciting. I hope to have other exciting things to be able to talk about as we sign these agreements in the coming days.
With regards to CDCP, you also said 93% providers are signed. And can you talk about that, like how this CDCP is huge success? When I go back to my writing, I always have a positive feedback. And then when you said that they find common ground, and this is something, this is our success too. I just want to let you know, like there's lots of MPs, even though CPC, you talked about that, their residents also getting benefit. So can you elaborate on that, like how people are feeling that?
Well, I think it's been incredible to see. The demand that's there exceeded, I think even what I understood to be out there. Watching out in the world, getting an opportunity to talk to providers. I was just talking to the head of the Canadian Denturists Association, who said he had a patient 64 years, same pair of dentures, if you can believe it. That was his record. For that lady, every bite was pain, down to plastic plates in her mouth. And now she has a pair of teeth, thanks to this program. I don't see how we could possibly have any partisan differences around that. That's something that's fundamental. You can imagine what that did, not only to her sense of dignity, but to her health. Dr. Redmond, I talked about Dr. Redmond because it was just one example, and it was one of the early ones. I visited him in Gander, and he identified his clinic 3 oral cancers in just the first 3 months. These are folks that would not have been caught. These cancers would have almost certainly developed into something much more serious.
Point of order.
So it's critically important, this program, and it's saving lives,
Doherty.
and it is actually primary care.
Thank you.
Point of order for Mr.
I
Doherty.
just want to offer the minister an opportunity to clarify his response. He said that the patient that he was referring to had a pair of teeth.
Mr.
Pair of
Doherty,
teeth.
that's not a point of order. You'll have
Just
a
a
chance
pair
to
of teeth,
clarify the questions when you get
A pair of
the
teeth.
floor.
Okay, thank you.
Please continue, Minister and Ms. Sidhu.
Thank you, Mr. Chair. Minister, my next question is, I know the SUBSB has a funding to CIHI to support them improving performance indicator related to shared health priorities across the country. Data is incredibly important to ensure we have a consistent measurement. Why investing in health data is so integral for Canadians and for improving the healthcare system across Canada?
Right now, that's a great question. So right now, if you look at Europe, Europe is working collaboratively to eliminate any barriers for interoperability in their system and to have data that flows as free as rivers. And with the advent of AI and new technology, if we have a fragmented data system with data that's locked up in places that we can't get hold of, we're going to be run circles around. And it misses an opportunity of prevention that's absolutely outstanding. I'll talk about our good friend and colleague, former colleague Arnold Chan. Arnold, who was very close to all of us. He was somebody who reached across the aisle and loved this parliament very deeply. And he was somebody who had a genetic form of cancer and didn't get caught early enough. But he was able to then tell his brother to get screened, and his brother found out that he had the same cancer. It saved his brother's life. In an interconnected data system, once we can sequence the human genome in the next couple of years and have that available to people, to be able to tell patients that they're genetically at risk for particular diseases is absolutely so powerful. And this is what Bill C-72 can unlock, and I think it would be a wonderful legacy to think of Arnold and what this portends by passing that legislation. I hope that we do it. But it also means incredible things for reducing administrative burden, and maybe I'll talk about that for a second. How frustrating it is to send the same form 3 or 4 times, to have information get lost in paper, to have not be the ability to send a prescripption digitally, to have tools like AI Scribe, which can do some of the most menial work around taking notes and take it right off a doctor's shoulders. If we have applied that across the system, that's equivalent to 1,000 doctors overnight, right, if we could put that in place. But we can't do that if we don't pass Bill C-72. So a lot of times data doesn't sound sexy, but the power of data to transform our health system is outstanding. Europe is doing it. We shouldn't waste a second. We got to do it as well. So I hope that we can pass it in this Parliament.
Thank you, Minister. Thank you, Ms. Sidhu. Suite, M. Thériault, pour 6 minutes, s'il vous plaît.
Merci, Monsieur le Président.
Thank you, Mr. Chair. Minister, did you send a directive to Sun Life since November 1st, or have you since November 1st, in order to stop requests for partial prosthetics? No, not at all. Thank you very much. Dentists in my riding in Quebec and seniors have come to see me to say that all requests had been refused. There was a survey of denturists in Quebec which showed that 99.4% of pre-authorizations for these prostheses are refused by Sun Life. A Sun Life employee stated to these people that the rare requests that are accepted are chosen haphazardly, randomly, and are not subjected to an analysis grid. And denturists have explained that they called Sun Life to try to understand refusals. They had received 15 refusals in a row, and the Sun Life employee stated that everything was fine with the requests, there were no mistakes, that Sun Life had everything it needed for the analysis, but that it could not accept these requests, and it was a directive coming from above. What's happening there, Mr. Minister, with your program? Can you have any control over it, and how do you explain that? You're talking about the dignity of seniors. These are the people who are targeted by these tools. Thank you for the question. This is a change in the system, and there are technical issues with how people are using it. I had a good conversation with the chief with denturists throughout the country, and it will take some time to solve the problem. But it's the same issues across the board, technical problems, and we want to make it better. It is a temporary problem. We have already found ways to fix the problem. If I can say in English.
Back to this. This is the largest program in Canadian history in the beginning of November. I believe I still have about 10 seconds left. So I believe I have 10 seconds, Mr. Chair. So we anticipated this, and we said that the pre-authorization process was deeply complicated, and that we needed folks to work with us. The head of the Denture Association, we had a great meeting. We were able to walk through the issues, talk about how we can get them solved. So I'm not concerned about that over the long term. I think I'm deeply committed to getting them fixed as quickly as possible. This is a different system, and so...
Come on. Je vais avoir du temps un peu pour parler, moi.
I want to have some time to speak, Mr. Chair. How can you explain that these requests made on the private side are approved, but they're not accepted by your regime, and people at Sun Life cannot tell denturists why a request for a partial denture is refused? It's not a technical problem, Mr. Minister. It's not. It's people who are not competent, who are not able to properly analyze requests, applications. It's a private program, and people think that they will have access to a service, and then they're being billed, and a blockage regarding services. There's a clear problem with the system. How are you going to fix it, and when will you fix it? It's been in place for only a couple weeks. It's a new program, biggest program in the country. There's an issue.
Putting in the forms, making sure that they're aware of what forms they have to send in. Remember, these are extremely costly. We need to validate for taxpayers that the work that's being done needs to be done. This program has existed for 2 weeks. I would say give us another 2 weeks to work through it. We already have made huge progress. I can understand you wanting to fix it. I'm a little confused by your anger. C'est pas nécessaire d'être...
You don't have to be mad. I would like to suggest that you apply the same criteria for requests made on the private side. Sun Life has already had to deal with these cases with private healthcare. Why is the list as long as a highway? It's the first time that I'm getting the opportunity to discuss with you. We want to talk about the issues and the solutions. We want a clear solution. But when will it be fixed, Mr. Minister? As soon as possible. With the leader of the National Association, most of the issues have been solved. We understand the solution, but it's going to take a bit of time, not a long time, because this program has only been in existence for 2 weeks. It's very new. Not for 2 weeks. For full dentures, it was going well. Now we have partial dentures, and all of a sudden, things go off the rails. How the interpreter regrets she can't interpret when two people are speaking at the same time. Why are these requests approved haphazardly? Thank you. Mr. Thériault, please give the minister the time to answer your question. With pre-authorizations, these are complex matters, and so verifications need to be done. I'm certain that the situation will be resolved. But with something so complex, we need to be sure that the system works correctly. Thank you, Mr. Minister and Mr. Thériault. Mr. Julian, you have 6 minutes.
Merci beaucoup, Monsieur le Président.
Thank you, Mr. Chair. I will carry on with the same question, the same line of questioning as Mr. Thériault. We know that it's quite a significant program in Quebec. How many Quebecers are using this dental care program that the NDP pushed for? How many Quebecers have received assistance surgeries through the program? And third question, how many requests are currently still waiting for a response? Thank you for the question. For people who were approved for services, there were 500,000 people in Quebec. That's a significant number of people. For the number of people who are registered, that's 1.2 million people. And on your second question, in most cases, there's no need for pre-authorization. And if there's no pre-authorization, there's no problem. When there's a pre-authorization, those cases are more rare. There have been issues. We're still in the first 2 weeks, but I'm confident that the problem will be resolved shortly. And I will ask questions to the officials after.
The reality is I'm a little surprised by the questions for the official opposition. I mean, there is no doubt this is one of the most popular new federal programs in decades. Just from a count, what you've said, Minister, 3,700 on average. Canadians in each and every Conservative riding in the country, including Mr. Doherty's and Dr. Ellis's, have received dental care. And what the NDP has fought for in terms of pharmacare means about 17,000 of their constituents. So it's a bit passing strange to me to see Conservatives threatening to kill programs that help thousands and thousands of their constituents. I don't understand that. But that's just a comment I wanted to express. In terms of where dental care goes from now, I do stress it's really important to extend it to others who meet the family income threshold beyond seniors and children and people with disabilities. When can we expect the government to look to coverage that would be for seniors who have existing dental programs that are very, very poor? That's a question that comes up from my constituents regularly. When do you expect to address the issue of Canadians who are denied dental care because they have a non-resident spouse? That's an issue as well that has come up. And in terms of the average response time for pre-approval for dentures, I would like to know what the existing response time is, in addition to the problem that Mr. Thériault raised. Thank you.
Thank you so much. So, yes, I think in the first order, 3 million people have signed up already. 1.25 million people getting care. The demand is absolutely massive, and I think we're going to be able to demonstrate in evidence not only what that means to people's dignity, but in terms of better health outcomes and frankly saving money, so they don't wind up in emergency rooms with much more serious cases. And we do have a lot of people left to go. Almost every single senior who's eligible has signed up for this program. But you're right about the additional cohorts. Now, what I said always was that this was going to be a very big lift. The pre-authorization is extremely complex. And one of the reasons why I said we didn't want to advance the new cohorts until we got the pre-authorization piece right. So this was anticipated. Working through these issues, I think, is critical. What I say, it's less a question how long it's taking. What's happening with the rejected claims is either information isn't being attached or there's a misunderstanding of what's being required. Because if you can imagine, this is very expensive, and we have to be able to demonstrate that there's integrity built around the system, that we're not, by its nature, it's not just automatically approved because it's quite complicated work. So it's not that it's taking a lot of time, it's that there's pieces missing and that people understanding what they need to attach is the problem. So that's why I think we can work through that pretty carefully.
But my question was the average response time, if you have that, or if we officials
I'll get
have
back
that.
to you on that.
Okay.
It's less an issue, but I will get that. But certainly I will get it for you, yeah.
Okay. And then in terms of the issues of Canadians with a non-resident spouse who would otherwise qualify for this program that has been so popular.
Yeah, I mean, I think both of your points are very fair. You mentioned seniors who have poor service on another plan, and you mentioned, folks who are denied because of a non-resident spouse. So these are issues that we would require, obviously, additional policy cover for, would probably require legislation, and so, that's something I would have to talk to you with your House leaders hat on with both sides to talk about, what's in the realm of the possible for us to be able to fix some of the gaps that I acknowledge exist today.
Okay, I've only got a few seconds left, so moving on to pharmacare, hugely important for people who pay $1,000 or $1,500 a month for the diabetes medication and devices. Nobody should oppose pharmacare. When do you see the first provinces signing on, and when do you see actually being able to provide that supports to people right across the country, including, on average, 17,000 people in each and every Conservative riding?
Yeah, you bet. So I think, look, we came out of the Senate on October the 5th. So there's a lot of details to chew through, but very, very early in the new year, I expect to see the first agreement signed. I think you can look at the MOU with BC to get a flavor for what those would look like. They use the existing infrastructure of provinces, so I think we can get medicine to people very quickly. And as I said, I'm deeply encouraged that a jurisdiction like Alberta, as I say, last week I was in Alberta announcing our plan for drugs for rare diseases, and Alberta was saying that they're very interested in signing this and finding a solution, and that Adriana, as their health minister, believes it can be done. And I think if we can do it in Alberta, we can do it everywhere. I believe we will.
Thank you, Minister. Thank you, Mr. Julian. Next, Mr. Doherty, please, for 5 minutes.
Thank you, Mr. Chair. Minister, everything good?
Yes, sir.
You're okay?
Yourself?
I'm good. I'm bright as rain. Just seemed to be a little bit on edge a little bit earlier on. But are you familiar with waiting your turn, wait times for healthcare in Canada, the report that was issued today?
I'm aware of it. I haven't had a chance to look at it. It was issued
So well, it's interesting because, Minister, it says that report reveals that out of 30 developed countries, Canada is ranked 28th in availability of doctors, 25th in hospital beds, 25th for psychiatric beds, 27th for MRI machines, and 28th for CT scanners. That's your record.
Actually, it's. I mean, I love how you don't hold Ford or any other government accountable for provincial health care. Healthcare is administered provincially. I'm not sure if you're aware of that, but we do try to.
Minister, I'm being respectful. You don't.
No,
have
but that
to be
wasn't respectful. You just said that it's something that's under provincial jurisdiction is our responsibility. That's not respectful.
Minister, that's your record.
But that's not true.
That is your record.
What are you asking about Doug Ford? What do you think the provincial government in Ontario should do?
Is Doug Ford in front of me right now? You're the Minister of Health.
Right. And so what we did is sign agreements with every province and every territory, $200 billion.
So out of 30 countries, you're happy with that?
That included metrics in every single. No, absolutely. Look, I am not happy or satisfied with where we are in healthcare. But the point is that we have one of the best health systems in the world, that when it comes to primary care, we can do
Minister,
much better, and we are. But provinces have to do their fair share, and not holding provinces to account is not responsible.
Mr. Doherty, please.
Minister, under your management of this file, 7 million Canadians are without a doctor. What have you done? What measurable steps have you done in the year and a half that you've been the Minister of Health to make sure that those 7 million or Canadians have access to nurses, to doctors? What have you done?
Well, I wish I had 20 minutes to answer that, because it's a very long answer. The first one starts with agreements with every province, every territory, $200 billion, common indicators across the system. With those common indicators, commitments on specifically doctors, nurses, and improvements in primary care. First High data out last year.
Canadians.
I believe I still have about 5 or 10
yes,
seconds.
keep going.
So,
Yep.
The first High data showing baseline report last year shows every province, every jurisdiction, almost without exception, ahead in doctors and nurses. That when you take a look at the investments that we're making in that I just talked about, C72 or health data, I can't say it fast enough because I got so much to say on it. It's great
Doherty,
news.
please.
You have a mandate letter?
Yeah, absolutely. It's a continuation of the preceding mandate letter.
So, Minister, you've been in this role for a year and a half, and yet Canadians have yet to see what your mandate letter is. Who sets your priorities?
Well, I think at the beginning I enumerated my priorities very clearly. Pharmacare, dental care, data transformation. Where do you stand with Bill C-72? Where do you stand on dental care? Where do you stand on pharmacare? What is your position? How are you going to fix? How are you going to fix?
Minister, in a year's time, you'll have lots of time to ask all the questions.
No, I won't, because you'll still be in opposition because you can't answer questions about what you're going to do for health care. No, what are you going to do on health care? How are you going to fix those problems? What is your policy
Mr.
solution?
Doherty, please.
Thank you.
What is your policy solution? Do you have any? No.
Minister, you're the one that's in power
Doherty.
right now. You've been in power for 9 years.
What is your
And yet
solution?
we're
If you're gonna
failing in
criticize, what's your
every
area?
metrics, Minister.
Your
A year
solution
and a
is
half.
cuts.
A year and a
You think
half.
cuts are going to
You're a
bring
failure,
doctors,
Minister.
nurses?
Please allow him to pose the question. Go ahead, Mr. Doherty.
You're so disrespectful. And weak. And you can stare at me all you want. Like mean mug me all you want. But Minister, the rates of scurvy are on the rise. Yet you're taking off the GST on pop and chips and candies, but you are raising the cost of everything healthy with your carbon tax. What's your rationale for that?
A, it doesn't increase the cost. B, if you cared about scurvy, then you'd be talking about initiatives in First Nations communities. The scurvy you're speaking about is in rural, remote communities. The policies that you have to deal with that are exactly nil. And I find it, yes, I'm very frustrated, Mr. Doherty, that the Conservatives would talk about issues like poverty. You know, I was in opposition. I watched you never talk about poverty. You never set poverty guidelines. You have no policies or ideas on poverty. In fact, your cuts will do devastating things to the very issues you're talking about. And I think it is dishonest and disingenuous when you have no solutions.
Mr. Doherty, please.
Minister, you're the only one that's talking about Conservative cuts. The only thing that we're talking about is axing the tax for everyone forever. That'll make life more affordable for all Canadians. The only one that is spewing rhetoric and garbage are the Liberals and the NDP, their coalition partners. So if you want to start telling the truth, that would be a novel idea.
So let's start with scurvy.
Minister, no, it's my time, not yours. So, I didn't. So, Minister, over 47,000 Canadians have lost their lives due to the opioid crisis. Okay. You've spent your government has spent $1 billion on failed policies.
Your time is up. Get to your question. We'll let him answer it, and then we'll move on.
Minister, what's your comments to people like Brianna McDonald's family that all they've asked for is for this government to stop their decriminalization and their failed drug policies?
25 seconds over time. Minister, please take 30 seconds to answer the question, then we'll move.
Thank you. In the first order, any person, and I know that you would share it in my heart, and you would share it in yours, that anybody who loses a family member is devastating. And we need to use science, data, evidence to provide solutions, not emotions and not fake policies. So we have to provide real answers, and that's what we will offer, true science-based, evidence-based decisions to save people's lives. And if you take scurvy, and I'll just finish on this because you want to talk about facts, somebody who's so food insecure that they have scurvy doesn't drive around a car. They don't pay carbon tax, but you would take away their check. You would take away the benefit that they get every single quarter that helps them pay for groceries. That's what you would do.
Thank you, Minister.
So you would leave them less secure and in a more vulnerable position. Sir, those are the facts.
Thank you, Minister. We're going to try Dr. Hanley again. I think you got the thumbs up on the sound check. Okay,
Yes,
you have the floor for 5 minutes.
And apologies to the committee for
Apparently,
my technical
we need to
problems.
do Dr. Hanley, we need to do a sound check. Go ahead.
Yes, Dr. Hanley, can you please
this is the sound.
talk about
This is the
the
sound
header,
check?
please? Yeah, this is the sound check.
Am I good to go?
You can continue
Okay.
talking, please.
I'm just talking to you from the traditional territory of the Anishinaabe Algonquin, and I'm hoping that this time the sound is working well.
Yes, the sound is working. Thank you.
Now you have
Okay,
5
very
minutes.
good. Okay, very good. Thank you so much. And my apologies to the committee for my technical problems. I do want to note that I want to reserve the final 2 minutes of my 5 minutes for Mr. Morris to ask an important question. So please, Mr. Chair, assist me in that. Thank you, Minister and officials, for appearing. I did want to ask a couple of questions. The first is in the supplementary estimates, there's $53 million to devote to increased support for scholarships and fellowship awards. I hear a lot about the need for more investment in health research and particularly in postgraduate research. I wonder if you'd like to speak briefly to the importance of that from your point of view, Minister.
Well, thank you, Mr. Hanley. And of course, we know that research is absolutely fundamental to health transformation. It is the pathway to understanding how we deal with the problems that face us in a complicated world. There isn't a health system that isn't facing these challenges in the world. And so I was so happy, as I know, Mr. Hanley, you were in the budget 2024 when we responded to the Bouchard report's recommendations to make sure that for postgraduate and graduate students that we have the appropriate supports for them to be able to study here and to be able to call Canada home for the research that they do. Research leads to miracles. It is very much the responsibility of, it really is thanks to research that we have been able to make the kind of progress we are. And I just give you one example. We talked earlier about diabetes. You know, type 1 diabetes, Canada is perhaps 3 to 5 years away from being the country that solves type 1 diabetes. And it is because of the extraordinary researchers in this country. So making sure the next generation of researchers have the support that they need is critical. So that money that was in the supplementary estimates to that end to further those goals is critical, not just to keep researchers here so that science is here, so that jobs are here, but so the solutions of tomorrow that end the diseases of today are driven and done here in Canada.
Thank you very much. And I'm going to hand over to Mr. Morris so that he has time to ask the question and you have some interchange on this important topic. Thank you.
Mr. Morris?
Well, thank you, Dr. Henley, and thank you, Chair. Mr. Holland, you might remember we spoke in Parliament earlier this year about a constituent of mine, Noor Aisha. She'd received a terminal diagnosis of bile duct cancer just after giving birth to her daughter back in February of 2023. She and her family and donors on GoFundMe had to raise money to fund a drug that had been approved by Health Canada but not recommended by the Canadian Drug Agency. It's a drug that cost $15,000 a month that extended her life. Sadly, Noor passed away about a month ago. The glimmer of hope is that the CDA is now in the midst of reconsidering its decision for a possible recommendation, as myself and more importantly, her own oncologist and other doctors had been calling for. But I'm sure, as you also know, the Canadian Cancer Society released a report this week that shows the average cancer patient in Canada is grappling with nearly $33,000 in costs over the course of their lifetime. I'm sure that saddens you the same way it does me. And so I wonder what you can do, even commit to, in terms of streamlining approvals and funding decisions to speed up access to cancer drugs.
Thank you, Mr. Morris. And I want to thank you for your advocacy on this and to say that the Noor's case is deeply tragic and is something that lights a fire in us to do everything that we can for action. So 2 quick points. Health Canada, once it approves that a drug is going to be eligible for public reimbursement, it's then up to the provinces that make the decision about whether or not it is publicly reimbursed. So Health Canada approves it, then the provinces decide if it's eligible for reimbursement. The arm's length decision of the Canadian Drugs Agency is important. Obviously, we want those science-based decisions to not be influenced by politics. But the agreements that we're signing with drugs for rare diseases are so critical. I was so excited to sign the third one in Alberta because it's a collective commitment to expand our action on drugs for rare diseases and to show a coordinated approach to these diseases. Because you take cancer and there's costs, and we got to do a much better job. But you know, it's pretty incredible in this country when you walk into the cancer ward of a hospital. You know, it used to be 30 years ago. I talked to a doctor there. When she started 30 years ago, the survival rate was only 30%. Today it's 90%. And when I talk to those patients, in fact, I talked to one patient just talking about the experience of an American family member who they just got wiped out entirely, lost everything because of a cancer diagnosis. That's not our case here. It's still too expensive. We have to do better. But I think seeing people where they are and recognizing the urgency of the devastating thing this does to families, because look, it's bad enough to get a diagnosis, but then to wonder how the heck you're going to pay for your medication is just fundamentally unfair. So we got to go as fast and as far as we can, and thank you for the question.
Thank you, Minister. Thank you, Mr. Morris. Suite, Monsieur Thériault, pour 2 minutes et demie.
Mr. Minister, you talked about 2 weeks, but it's not only a matter of 2 weeks. People were waiting from November 1st to have access to services. It's the 12th of December, so the math isn't mathing. You've stated that this dental care seemed to be, and it seemed to be written on the corner of a napkin. Honestly, there are people who think that it's free. People arrive at the dentist, they realize that they have to pay, and many have said to me that dentist fees have almost doubled. Why did you not take the time to sit with dentists, negotiate fees, instead of letting Canadians deal with a humiliating situation where they don't have the money to pay for care, and you're told at the end of the day, no, it's not actually free, you're going to have to pay the difference? How are you going to take control of this? People who are taking the government's contribution as a gift card.
You've been against the Canadian Dental Care Program. People have no coverage. So now you're saying that them paying a small fee is terrible when you're saying they should pay, they had no coverage. 500,000 people had care in Quebec. You're dismissing it like it's nothing. 500,000. 500,000.
500,000 people. That's extraordinary. That's good news. And that's not just in Quebec. Please just answer the question instead of sharing propaganda. Monsieur Thériault, you took more than a minute to ask your question, so the minister has enough time. Well, then give me 5 minutes to ask my questions. Not a problem. Continue on with your question. You have 15 seconds left. Well, just answer the questions then, instead of sharing your propaganda. You didn't implement this regime well. There are people who don't have access to care that they expected to have access to. And you're saying, well, it's a matter of 2 weeks. It's something that will be resolved. You can't tell us when. I find that writing up a program on a napkin on the corner of the table. I don't agree with you. You only have 20 seconds to answer, Minister.
500,000 people got care. That's just over 6 months. And you're saying it's on a napkin. You say that you dismiss it like it's nothing. And then your position is to not have them get care. And then you're angry that they're not getting care fast enough. And then you're saying pre-authorization isn't being fixed, but you're against having pre-authorization. So you would take away right now, tens of thousands of people in Quebec, tens of thousands have got dentures. This is great news. And instead of celebrating that, you're attacking and saying get rid of the whole darn program because it's taking a couple of weeks to fix a couple of technical problems. That's not logical to me.
Thank you, Minister. Mr. Julian, please, for 2.5 minutes.
Merci beaucoup, Monsieur le Président.
Thank you, Mr. Chair. I think it'll be difficult for the Bloc to defend a position that would eliminate a dental care program. And the NDP pushed for that. And 500,000 Quebecers have already had access to these services?
Provinces, particularly conservative provinces, that are undermining healthcare. British Columbia, we have a very strong province. I took my neighbor to the emergency ward. We had to wait for an hour. In Doug Ford's, Ontario, last week I was in, and I'm being interrupted and heckled by the Conservatives because, and that's
Mr. Doherty,
are you
please,
okay,
you don't
Todd?
have the floor,
Okay?
and
I
nobody
have to
tried
ask
to
it.
interrupt you when you did. Go ahead, Mr. Julian.
Thank you very much, Mr. Chair. So in going to the emergency ward at Ottawa Civic last week after a bicycle accident, it was 14 hours. And Mr. Doherty thinks that's great, and so does Dr. Ellis. Conservative provinces have been terrible on healthcare outcomes, terrible on extra billing. And I want to know what actions you're taking as health minister and the government is taking against this extra billing and the erosion of our healthcare system, particularly in Alberta, Saskatchewan, and Ontario, which are the worst offenders and have absolutely terrible health outcomes, terrible waiting lists, and terrible healthcare systems undermined by conservative politicians.
Well, and look, it takes everybody moving in the same direction. And it's not enough that the federal government does its part. Obviously, hospitals and health systems are actually managed by provinces, so it's hugely consequential whether or not they make the appropriate investments, and you're absolutely right in that. I think one of the things that I would point to is the agreements that we signed with provinces. You know, for the first time, there were conditions, there was tailored bilateral agreements, there was common indicators. CIHI just had their baseline data. When it comes out next year, we're actually going to be able to see in data rather than an anecdote which provinces are making the advances and which ones are not. And I think, you know, it's very interesting. Manitoba, Nova Scotia, BC, these elections turned on healthcare. People care deeply about this. So I think there is certainly a major electoral consequence to it. We have used the Canada Health Act in many different instances to charge provinces when they're charging private fees. But this is a major topic. We have a health ministers meeting coming up, and I would rather get there through collaboration. Obviously, that's the preferred goal. I've had a very good conversation, as an example, with Jane Philpott in Ontario around the work that she's doing in primary care. I think that there's, you know, Michelle Thompson, who I was talking to, sharing messages, you know, she's got some great ideas in a conservative jurisdiction on how they can improve their health system. There's no reason for this to be, you know, just because a government is conservative, they don't need to take the federal conservative position of cuts and attacking the health system. There's a way that we can work together collaboratively, and I think that's what we should do.
Thank you. Thank you, Mr. Julian. Next, Ms. Goodridge, please, for 5 minutes.
Thank you. So, Minister, we had BC RCMP Assistant Commissioner Wilnig come into Health Committee about 6 months ago. He was talking about the very serious concerns about how 80% of the precursor chemicals used in fentanyl production are still legal and unregulated in Canada. Why has Health Canada been dragging its feet for the last 2.5 years to do anything on this?
Well, I think one of the greatest concerns with this is a lot of these precursor chemicals are used in normal legal commercial enterprises. So it's very hard to stop some of this because a lot of what's being used can be found in legal products. So, but I deeply share this. This is one of the things that's being worked on very actively now as we have a conversation with our American counterparts. How do we do this together? And I think a North America approach where we're working collaboratively across North America makes full and complete sense.
So because the U.S. finally has said this is enough's enough, you are finally going to take action. You've been in government for 9 years. Why won't you actually take immediate action to make sure that Canadians are safe? Canadians are dying every single day. 22 Canadians are dying from addiction every single day under your watch.
So the problem with fentanyl is that it is so insidious. It is so easy to manufacture, to hide, to send, and so it is so devastating. And we have absolutely been taking every action that we can to both block the precursors. I explained the complication with a lot of them being legal, and also to take action to stop the supply. That's nothing new about working with the United States. It's about trying to have a conversation with a new administration about how we collaborate better. But the action that we've been taking is doing everything that we can on the basis of evidence and science, and I can assure you that I care about it every bit as much as you do.
Ms. Goodridge.
So what Canadians can hear from what you've just said is you're doing nothing and you're okay with that. So back to this whole conversation around scurvy. Food inflation has increased 36% higher in Canada than it has in the US, which means the carbon tax that you guys continue to jack up, and you plan on jacking up again come this spring, is going to further make food more expensive. Canadians are now getting scurvy. Your plan to remove tax for a couple months on Chiefs Puffs and chips. Why not make healthy food more attainable so that Canadians can eat?
So as I just explained, scurvy is existing in communities of extreme food insecurity, mostly Indigenous. These people don't have cars. They're not driving around. They pay no carbon tax, but they do get a carbon rebate. Your policy would be to take the rebate away from them. I can guarantee
Minister,
taking cash away from somebody is not going to help them not have scurvy. And I would ask,
Minister,
what are your policies? I can tell you what our policies are around food insecurity. And then the second thing I would say, can you tell us whether or not you support vaccinations? Full stop. Because a lot of misinformation around vaccinations and a lot of misinformation around diseases cause problems. And I've been trying
Minister,
to say that we should have a unified view on these issues.
Quite respectfully, most of these communities that are seeing scurvy increase are in the north, where they do in fact have to pay carbon tax to heat their house, to keep the electricity on. That's a bill they see every single month as a direct result of your government's policies. And frankly, it's really rich for you, coming from a Southern Ontario area, to be sitting here lecturing me on what food insecurity looks like in the north, someone that lives north. So I'm sorry, Minister, this is absolutely part of the problem. If you guys just got rid of the carbon tax, people could afford to heat, eat, and house themselves. Why won't you take the carbon tax off?
Because that's disingenuous and untrue. That the people that you're talking about who are so food insecure that they have scurvy are almost exclusively in Indigenous communities. These are people of very limited means that are not paying next to anything in terms of carbon tax.
So you're okay with that?
What I'm saying,
okay
what I'm not okay,
scurvy?
I don't know if I'm allowed to finish.
Yes, you are.
If I'm allowed to
Please.
finish,
Yes.
the point that I'm making is that these people get way more back in a rebate check that they can use for food insecurity. You would take that away from them. So in other words, you would, in terms of a price on pollution, you would eliminate the action on pollution and protecting our climate, and you would then take away money that they get where they would be left in an even more insecure situation. And I think that's disingenuous to saying somebody who's suffering that you're going to take away money that they need.
Quick, just a
What
short
have
question.
you done to improve the people that are getting scurvy today? What has your government done to make sure that Canadians are not getting scurvy?
Just a short
Have you
answer,
done anything?
Mr. Please.
So the first thing is we've tripled investments in First Nations communities and are taking historic action in First Nations communities. Those are way over the levels that were there under the Conservatives. And I can tell you the number of boiled water advisories in those communities and poor health outcomes were much worse under Conservatives and would be again with the cuts that you would visit upon them. In terms of the country writ large, things like the school food program, things like making sure that women have access to child care so that they can afford child care, making sure that people get the savings that come from dental care and pharmacare. That's real help.
Thank you.
Making cuts isn't going to help any of those people.
Thank you, Minister. The last round of questions for you will come from Mr. Nakvi for 5 minutes.
Thank you very much, Chair. Welcome, Minister, and to our officials as well, and we shall be speaking with you soon. I want to start also on the theme of research. I think Dr. Hanley was talking about research. I know in my role as your parliamentary secretary, I've had the chance to meet with some incredible stakeholder groups who've been advocating that we invest more in research funding, and Budget 2024 really delivered in that respect. I want to in particular, want to talk about brain research. In the supplements, there's a $10 million in funding for Canada Brain Research Fund to advance knowledge on the brain diseases and disorders, and accelerates discoveries for improving the health and quality of life of Canadians affected by brain disease. Why is this funding into this research area critical in your view? And before you answer this, I do also want to put on record that our colleague Alistair McGregor, who brought in Bill C-277 that went through this House, and he sought unanimous consent in the House so that it could pass, was denied UC by the Conservatives, which was rather partisan, because we heard clearly from so many witnesses the need for a brain research framework in Canada, which we're looking forward to working once it passes into law. So question again, but we're moving ahead with this research funding. Why is it so critical to support research when it comes to brain in Canada and globally?
Well, thank you very much, Mr. Naqvi. And I think that you're absolutely right. It was unfortunate that it was voted against the support for brain research. This is absolutely critical for a wide array of neurological conditions. And I think when you meet patients, one of the hardest things, these are the types of things that stay with you afterwards, long into the night. Meeting patients who know that research is so close to giving them answers to get back their lives and to be lifted out of the pain they're in or the condition they may have. And they so desperately want us to make these investments. And I would suggest it's an area where we really could put down the partisan swords. I think I mentioned another one, which is C-72 on interoperability of data. Again, I'm not aware of any opposition to these things. And yet they're not supported because there seems to be a view to being against everything is the job of an official opposition. I just don't agree with that. I think I did spend time in 2 terms in opposition where you try to advocate for solutions and ideas. And I think Parliament in this minority government has gotten a ton done, and yes, on research. We are in a time of miracles, and we need to press just a little bit further so that the people who are afflicted with diseases and conditions can be elevated and live their best lives. And it's a roll of the dice. It could happen to any one of us. And I think all of us would hope that if one of the people that we loved or ourselves had a condition visited upon us, that we had a country that was doing everything it could to find solutions and invest in the science and the data and the evidence to find answers.
I agree with you, Minister. And I'll be frank with you. I think Conservatives have been really disappointing. I mean, they only have slogans. They stand in the way of progress. They have an agenda of cuts, and they prove it again and again every single time. And they're just hungry for power, and that's it. And they've lost the purpose around really serving Canadians and finding ways to working together. And we see that. And I see this in this committee, just insults, long, frivolous speeches, on and on it goes. Anyways. I want to come back to Canada Dental Care Plan because I think that's really exciting. I continue to meet with seniors in my community right here in Ottawa Centre who are telling me that they are finally getting a chance to go see a dentist or a denturist and getting the care they need for a long, long period of time. I'm sure you're hearing those stories as well. Tell us where we are at. What are the next steps when it comes to CDCP? Because there are many others also in my community who want access to this program.
Yeah, absolutely. I mean, so let's talk about seniors first. When we were there announcing the 1 million mark, 1 million people connected to care, there was a gentleman who was at the clinic we were at who came up to me and he said, a lot of years ago, I had to get a tooth pulled and it cost $700. And he said, you know what, I didn't go back. I had problems in my mouth. I was terrified to walk in. I knew I couldn't afford it. I was afraid to get care. And he said, and now I'm getting care again. I'm not afraid to go into the dentist. This is what this is about. People being connected to the care that they need and not having to be afraid that they're not going to be able to afford it, not being terrified when they get a pain in their mouth, whether or not it's going to lead to some devastating outcome that they can't afford and they have to wait to be in an emergency room to fix. I hear stories of seniors. When I was talking to a mobile smile clinic in Windsor, Navjeet was telling me about seniors setting up their family photographs once they got their dentures in and how it's transforming their life and the joy that it gave them. I'll tell you, we're all going to exit this earth, and we're certainly going to exit this Parliament. But those stories will stay with me for the rest of my life. And connecting people to that care everywhere is absolutely critical. And we have a lot more people to go. We're going to get there. We're going to do it as fast as we can.
And every single step of the way, Conservatives have voted against that program.
Thank you. Thank you, Minister. Thank you for staying longer than was scheduled. That brings us to the end of this round of questions. You're welcome to stay, but you're free to leave. Colleagues, I don't propose to suspend the meeting. We have a budget for the supplementary estimates that I would like your approval of. And while we're approving that budget, perhaps we could have the other officials take up their places. There have been some discussions between the parties. There's some MPs that are going to be racing for the airport soon. So I would propose when we get the officials back up that we have even turns between the four parties of, say, 4 to 5 minutes that will allow for adjournment at about 5:30, which will allow some of us to catch our flights. Is everyone comfortable with that? If not, we'll go through the normal rounds of questions and entertain a motion for adjournment in the normal course. Okay, I see some thumbs up around the table. Thank you very much, Mr. Minister. Very much appreciate you being here, as always. Okay, so there has been a budget circulated to you, colleagues, in the amount of $1,000. That would cover this meeting and the next, with the one with Minister Holland and the other with Minister Sachs. So I would ask for approval of that budget so that you get to have a sandwich or something. Is it the will of the committee to adopt the budget as presented? Yes. Okay. I see no objections and a few thumbs up. The budget is therefore adopted. Can we do the sound check for Mr. Poloski? Okay. And we're going to do a sound check for Dr. Poloski, and then we'll start with rounds of questions.
I think I'm okay because I think Ariel will do the questions.
Excuse me, Mr. Poloski, but we need to do the sound check.
I won't be asking questions, however. You can try, but Ariel will be asking the questions for us.
Okay. Okay. Right.
Okay, thank you.
That makes it easy. Thank you, Dr. Poloski. Okay, I have 5:10, so I'm going to propose questions of 5 minutes in length. So we have a couple of additional officials with us. I'll simply introduce them, and then we'll open it up for questions. So joining the meeting at this point from the Department of Health, Jocelyn Voisin, Assistant Deputy Minister at the Health Policy Branch, and Dr. Cecilia Lorenzo, Associate Assistant Deputy Minister, Health Products and Food Branch. And from the Public Health Agency of Canada, Martin Crumans, Vice President and Chief Financial Officer. Welcome to the newcomers. Thanks to the rest of you for staying here. We're going to now begin with rounds of questions, I believe starting with Dr. Ellis for 5 minutes. Dr. Ellis.
Thanks very much, Chair, and thanks to the officials for being here. The nature of my questions today will be on the topic of lapsed funding, so if that's helpful to all of you. Mr. Corsten, from the reading that we've been doing and what it appears that in Health Canada, almost 35% of total funding ends up in lapsed funding. And my understanding is that lapsed funding, of course, is not spent on programming. Could you explain to the committee where that lapsed funding goes when it's obviously not used, back into general revenues perhaps, and which programs exactly are affected by lapsed funding?
Thank you very much for the question. Thank you, Chair. Honestly, I think there are many reasons why programs would lapse funds. There are many consequences to lapse funds, some of which are to have it returned to the general revenue fund. I think in order to give you a sort of a precise accounting of the source of lapse funding for the department, it's probably best that we return to you in writing. We'd be happy to provide that information.
That would be great, Mr. Costin, if you could. And would you be so kind as to detail exactly which programs were affected? And I think it'd be important to look at the last couple of years for lapsed funding. If you would do that and table it with the committee as soon as you can, that would be great.
Yep, that would be fine.
Thank you very much. Ms. Jeffrey, I would ask you the same question under the Public Health Agency of Canada. It would appear that there is lapsed funding in the years that we're able to look at. I obviously don't have this year's figures, but perhaps 47% of the funding of PHAC ended up in lapsed funding. And my question to you is similar to Mr. Costin. Could you confirm that that is a considerably high number, in my opinion. And if you're not able to do so now, could you please table with the committee the exact programs that have been affected over the last 2 years with lapsed funding?
Thank you, Mr. Chair. Indeed, in 23-24, the lapse reported by the Public Health Agency was $1.1 billion. All of this money, in large part, was related to COVID-19 expenditures that did not need to take place due to the fact that the emergency phase of the pandemic has subsided. Some of this money, $59 million, was reprofiled to future years. And the lapse is attributed to a reduction in vaccine and therapeutics procurement, a reduction in the need to purchase medical countermeasures, and a reduction in the costs of warehousing due to the end of the emergency phase of the pandemic. If you'd like further detail, we have our CFO, Martin Crimmins, here who can further elaborate.
I appreciate that. I think that's sufficient. Again, if you could table that in writing to the committee, that would be most helpful. A couple of questions, Ms. Jeffrey, if I might. And just for the record, that I believe Ms. Jeffrey concurred that, yes, she would provide that in writing. I saw her head nodding, just to be clear on that. Talk a bit about the national stockpile for Canadians, if you would. How are we doing with the national stockpile? And do we have specific measures in place related to ensuring that we're not going to have expired national stockpile as we saw before the terrible pandemic of 2020?
Thank you, Mr. Chair. Indeed, a comprehensive management plan has been put in place for the National Emergency Stockpile. The stockpile contains both assets in the form of goods such as cots and blankets for emergency response, as well as medical countermeasures, vaccines and therapeutics to support provinces and territories in emergencies. An inventory management system has been modernized and put in place. The stockpile is obviously much more significant than it was pre-pandemic, and it has a diversity of supplies and has been used, in fact, to respond to emergencies since COVID-19 outbreaks such as Mpox and wildfires and other areas where provinces and territories requested federal support.
Thanks very much, Ms. Jeffrey. And could you undertake to provide the committee a list of those items that are in the stockpile and the amounts? I think that would be important for Canadians to know. For instance, are there N95 masks there, cots, blankets, the numbers? That would be important for Canadians to know. So, as I said, if you could undertake to provide that to the committee, I think that would make sense. We've come back previously to this promise from the NDP Liberal government on the Canada Mental Health Transfer. And Mr. Costin, if I recall correctly, back when I came here in 2021, the amount was $4.5 billion. Can you tell the Canadians how much of that $4.5 billion has been allocated to mental health care?
I couldn't off the top of my head, but I'd be very happy to return with that figure in writing.
Thank you, Mr. Costin.
That'd be great. Thank you.
Thank you, Dr. Ellis. Next, Ms. Kayabaga for 5 minutes, please.
Thank you, Chair. I would also like to thank our witnesses for being here today and welcoming them. So this week marked a year since the launch of the Canadian Dental Care Plan, which has helped over 1.2 million Canadians to access dental care. If we could just get a breakdown on how many dental care providers are accepting the CDCP patients and the update and comments on how the transition has been so far.
Thank you so much for the question. I certainly can provide a bit of precision on some of the figures, which I believe Minister Holland noted in his commentary. So to date, we have over 23,000, so to be exact, 23,010 providers who have made at least one claim. And based on our estimates, that accounts for about 93.5% of all eligible providers. I think in terms of a commentary, as you know, with regards to how the transition has gone, I think there was a very good discussion earlier about the latest phase where we've encountered some difficulties with respect to pre-authorization, and we're working through those on a priority basis. Prior to that, I think we're feeling reasonably good about the manner in which the program has been stood up and implemented and services have been provided. I think there's been active outreach to providers including those who work in their offices and frankly have to do a lot of the hard work with respect to administering and filing forms and the kind of where the rubber meets the road with respect to the application of the program. And I think that has paid off. I think we're all very aware that at the outset there was a lot of nervousness and concern that administrative process would be overwhelming and difficult. I think over time we've through engagement and other types of very dedicated undertakings, we've managed to work through that quite successfully. And I think we remain confident that as we continue to implement through phases, while there may be some bumps in the road, as they say, we will certainly endeavor to continue to make the transition as successful as it can be. So I think I can stop there.
In January, I think the plan is going to be accessible to a larger amount of Canadians in different age categories as well. When that happens, what is the plan to ensure that current employers who provide the coverage for these Canadians are not going to opt out for the sake of putting them, because the purpose of the plan is to reach the people who need it most. How are we going to make sure that the people who need it most are the ones that are accessing it?
Thank you for the chair. Thank you for the question. I think our strategy will continue to be the one that we've adopted over the past year, which is proactive outreach, dedicated communications in order to raise awareness and ensure that those who are eligible are aware of the program and are assisted to access it in every possible way, so that we can ensure that there's broad awareness and good uptake. And we'll certainly do everything we can working with Sun Life to ensure that the process is as smooth and as accessible as it can be.
What are some of the measures that you have in place to work with current employers who cover Canadians that fall into the category of the income targets that we have, to make sure that they continue to cover them? Because again, the program is for Canadians who do not have coverage, not ones who have coverage. But if there are no measures set in place to ensure that employers are not just going to withdraw their coverage from employees, we're going to have, I mean, I would assume that this would overwhelm the plan. Can you comment on that?
Yeah, well, I guess I would make two comments. So as a part of the department's outreach, I can commit that we will be certainly working with employers and major employer groups to ensure that there's broad awareness, particularly on lower income Canadians. I might want to also offer a clarification that I believe in your earlier question you noted January as being the date. I don't believe a date has been set or publicly committed to. So I just wanted to make that clarification. But absolutely, we will be working carefully with major employees to ensure that major employers to make sure that their employees are well aware of the services that would be available to them through the CDCP.
Thank you, Ms. Kayavaga.
Apologies.
Thank you.
Sorry, Chair. Just want to say sorry for the date. It's not that it was given to me by any official or anyone. It was just from a conversation I had with dental caregivers in my riding. Thanks.
Thank you, Ms. Kayavaga. Monsieur Thériault, pour 5 minutes, s'il vous plaît.
You have 5 minutes. A rigorous management doesn't mean that a new program can be mediocre. The minister's responses showed me that Sun Life must be smiling from ear to ear, because the answers that professionals have been receiving are unacceptable. Now, let's move on. A QR code for cannabis, that's in place. For natural health products, why is that not the case?
Merci, Ms.
Thank you for the question. We are working on that. We're working on that with industry. We're holding meetings in order to talk about potential solutions regarding the use of QR codes for these natural health products. That's an answer that's similar to one that I've already heard. Does that mean that we're doing a feasibility study of a QR code in order to respect Health Canada's expectations as well as industry's expectations. Yes. Solutions using that kind of technology are a part of discussions that we will be having with industry in the coming weeks and months. Administrative fees for Sun Life. We've understood that it's about $2 billion. Can we see the contract? Was it tabled somewhere with supply, for example? Are there any clauses? With the situation that we're looking at right now, this isn't worth $2 billion. We were saying to people, November 1st, you'll have access to services. But maybe not. Now, it's December 12th. And they're receiving answers that it's a bit random, and then there are denturists that are spending money to offer partial dentures or take measurements. Can we see the contract to see where things are going wrong? Thank you for the question. I'll respond in English if that's all right with you.
I think I can speak generally to the terms of the agreement with Sun Life, but I'm not in a position where I'd be able to disclose the contract. And I think
point of order, Chair.
Oh, Dr. Ellis.
Perhaps I'm mistaken, but my understanding of the rules is that if we demand the contract here, that certainly as parliamentarians, we are allowed to see those documents. We've been through this before. It's been difficult, but certainly if M. Thériault veut voir le contrat, je pense.
If he wants to see the contract, I think he's allowed to do so, and it's part of his privilege and the privilege of this committee to see the contract, Sun Life's contract. And I would support wanting to see that contract.
Mr. Thériault.
Mr. Thériault still has not made that request officially. If he does so, we will manage the situation. You have the floor, Mr. Thériault. Mr. Chair, I asked if we could see the contract, and the answer was, well, I could talk about it in general terms, but I want to know what is in the contract. So yes, I want to see the contract.
Mr. Chair, I mean, certainly happy to, respond to that request. Also, be very happy to sort of detail the administrative costs and the arrangements that we have with the.
Point of order, Chair.
Dr. Ellis.
I'm not entirely sure what Mr. Costin is giving us as an answer.
Dr. Ellis, if you had the floor, you would be able to ask those questions. That isn't a point of order. You didn't like Dr. Costin's answer, and therefore you've sought to intervene. No, I think Mr. Thériault is quite capable of handling himself.
Chair, the point is again, we have the opportunity, as you know, to demand documents here, and I don't think Mr. Costin maybe perhaps understood that. Well, when that's exactly what Mr. Thériault asked him.
You make a valid point that is not a point of order.
No, I think it is, Chair, but related to the production of documents, that this witness is skirting the issue.
Okay, I don't accept that as a point of order. Mr. Thériault, you have the floor.
Est-ce qu'on va pouvoir avoir accès?
Can we have access to the contract? Will you send it to the committee so that we can see what you have agreed on and why, and what explains such a situation, yes or no, and when can you do it?
Thank you, Mr. Chair. I will have to take the request from the committee for the access to the contract back and respond in writing.
Monsieur le Président, j'en fais la motion.
Mr. Chair, I would like to table a motion so that we can receive the contract. We want to see what's in it because there is an issue in Quebec. In Quebec, we were wondering why it wasn't the RAMQ They'd been managing a program for over 30 years. Why give the contract to Sun Life? The RAMQ, with all of the IT systems that they have, could have done the work. But no, you chose Sun Life. So we want to see the contract. We want to know why it's so costly, and we want to know if the current shortcomings are going to increase administrative costs. That's why I want to see the contract, Mr. Chair.
Crystal clear, Mr. Costin. Even though it wasn't a point of order, Dr. Ellis makes a valid point. It is within the power of the committee to compel the production of documents. You've received a request to produce the contract. I expect that you're fully aware that there are consequences if you do not. So the request has been formally made. We would expect a production of the contract or an explanation that will likely be acted upon by the committee if it isn't. Okay?
Understood.
Last round of questions to Mr. Julian.
Thank you very much, Mr. Chair. And it is important to recall to the committee the incredible dismal record during the Harper reign, where Harper Conservatives refused to ever provide any document of any sort, covering up their scandals, which were myriad, billions of dollars misspent. So again, a bit passing strange when the Conservatives were in power. They were terrible, awful, abysmal, and we never got to the heart of anything. I'm glad that because it's a minority parliament, we're able to get to the bottom of things. So that's important, and it's in the public interest. We can never go back to the horrible days of the Harper regime. I wanted to come back to the questions that I asked, and I thank our witnesses for being here. The issue around response time for pre-approval, that's something I asked the minister. It's more properly a question to officials. Do you have that information? Because, again, this program has been wildly successful everywhere, particularly in Quebec and right across the country. It's important to know how we can make the program even better.
So on pre-approval, on the pre-authorization process, where it's about 7 to 10 days turnaround.
With the exception of that problem that was identified by Mr. Theriault. Yeah. Okay. Thank you. I want to move on to the Pharmacare Expert Committee that was put in place, and want to know whether the work plan has been established. This was with Dr. Nav Prasad, Dr. Stéphane Ahern, Amy Lamb, Dr. Steve Morgan, and then DeSilas. It's a terrific committee of very respected Canadians, and they will be mapping out by October 10th, the deadline, of course, being the one-year anniversary of the Royal Assent on the Pharmacare bill. Has that work plan been put into place? Has the committee met?
The committee has met once. I don't know that they have a full work plan in place yet, but they have met once, and there's a plan for them to meet again in January.
Terrific. So at this point, you have no concerns about them meeting that important deadline for rolling out Pharmacare on a more broad basis?
Well, I think they're on track to do their work. They have met once already.
Terrific. As well as the issue around the formulary and the national bulk purchasing strategy, both part of the Pharmacare Act that the NDP worked so hard to get through the House and the Senate. Has work started on those two aspects as well?
So as laid out in the bill, as you know, the CDA, the Canada Drug Agency, is tasked with leading on that work. And so they are certainly taking the steps to go forward with that.
Terrific. Okay. Now I want to come back to the issue around Canadians who are being denied the dental plan coverage because they have a non-resident spouse. And this has happened quite often, and it is something that is an easy fix, I believe. So I wanted to see, the minister said they're working on it. I want to see what your deadline is in responding on that. I have constituents who are very excited about the Canadian Dental Care Plan. They want to use it, but currently they're in suspension in their application because they have a non-resident, non-Canadian citizen spouse.
Thank you. I can elaborate a little bit on what the minister said, as I'm sure you're aware, I'm not sure if everyone's aware, but as a part of our eligibility verification process, we have to check family income in order to understand whether the person applying is eligible or not. If a foreign spouse does not report their income in Canada, that makes that process very, very difficult, almost impossible. So finding a solution to that very, very specific problem is what we're actively working on. We hope to have a solution as quickly as possible. We understand that it affects a good number of people. It's very intrinsic to the eligibility verification process, and so we're kind of working through the practicalities of how to do that.
Thank you. Final question, because I know I just have a few seconds left, and that is we have the issue of expanding the program. The minister was clear about moving on that. Many Canadians want to have access to dental care. At the same time, there is a small percentage of flake rate of people who no longer meet the income eligibility and family income over the course of a year. Their income may go up. I would hope that the government is putting the emphasis on getting new people into the program rather than addressing that flake rate. But is there an estimate of what that flake rate might be?
I'm not aware of an estimate that we have for that adjustment. We're just very aware of, and that's part of the thinking we're doing around the annual verification of eligibility. But I don't have an estimate as to what the grade might be.
I would suggest it's very low. Yeah.
Thank you both. Thanks for your patience and professionalism in responding to our questions. We've got a few people that are rushing off to the airport now. Is it the will of the committee to adjourn the meeting? Yes, sir. We are adjourned. Thanks, everyone.